Hi, this is Dr. Toy. In this segment, I'd like to talk to you about Achilles tendon injuries. As we know, the Achilles tendon runs down the back of your leg and inserts on your calf. What makes the Achilles such an interesting muscle is that it actually crosses three joints. It crosses your knee joint, your ankle joint, and your subtalar joint. It's the only muscle in the body that does this. Therefore, its effects are very far-reaching. It can affect your knee function, your ankle function, and your foot function. If my patients would only stretch their calf muscles the way I asked them, I would probably be out of a job in 6 months. But nobody ever seems to stretch their calf muscles until they've already had an injury. And the problem with the calf muscle is it just doesn't always injure the Achilles tendon or the calf muscle. By having a tight Achilles tendon or a tight calf muscle, you can't walk properly. You don't have a proper heel-to-toe walking motion, so that when you do walk, you have a change in your gait. That can lead to stress fractures, it can lead to compensation, or, as I mentioned in another segment, it can lead to a peroneal tendon injury. And these are all injuries that are caused merely because your Achilles tendon is tight. The Achilles tendon can be easily stretched, but it takes time. To get a nice, long, passive stretch, you need to stretch it continuously for 60 seconds, 4 to 5 times a day, every day. The muscle shortens back up because as we sit, the attachments from the knee to the heel is shortened. Therefore, the muscle wants to constantly shorten. Also, women wearing high heels a lot often have a great deal of trouble when they retire going from high heels to a lower shoe simply because their tendon is too tight, and therefore they develop all these different problems involving their foot. Once again, these are things that you don't have to go through. A simple stretching program that a podiatrist and your physical therapist can recommend for you, demonstrate for you, and then follow through to make sure that you're actually getting the range of motion that you need. Merely stretching this muscle would likely alleviate 80% of the population's foot problems. And that's a simple thing to do.